Alright, hi guys, my name is Joseph Wright. I'm going to be talking to you about mental health awareness. A little bit of background and overview for you. Approximately 450 million people suffer from some form of mental disorder, and around 40% of countries worldwide have no mental health policy, meaning that these people suffering can't even access the help that they're needed. People around the globe are affected by mental health disorder, and these disorders are becoming a norm amongst our youth. The prevalence of these deadly disorders is taking its toll. Um, Lack of education of mental health throughout the education program is terrible, and it's leading to suicide and drug addiction. Suicide and drug addiction is high amongst those with mental health disorders, changing the stigmas held against mental health and the disease that affects so many lead to a change in how society views this major health risk. Spreading awareness of mental disorders, how they are more common than you think, and what steps can be taken to cure or subside the many effects mental health disorders and diseases have on society and the individual. Um, some key issues. Um, Research has found that individuals with mental health disorders are less likely to be employed, even if employed. Even if employed, they were more likely to miss more days of work and be less productive during those days of work, even having reduced earnings compared to those without mental health disorders. My research will investigate the effects stigma and discrimination have on individuals with mental health disorders, as well as people suffering from mental health, and how lack in education contributes to health issues. Okay, so my research question: what effects arise due to the insufficient mental health awareness for American youth? And I will try and answer this question through the research that I've done. Um, Methods that I use to gather my information and research. To identify the sources that I got, I analyzed the University of Florida online database of scholarly journals and novels to find relative literature. And when selecting specific sources, I look for specific criteria such as adolescence, negative lifetime effects, and poor mental health. To get a broad idea of what implications truly are true implications truly are, I tried to make sure information did not overlap to avoid saturating my research. So, in my research findings, these are just a few, and I'll go into detail more after I label them. Not enough sufficient training for social workers, especially educational based workers such as teachers, counselors, um, school administrators. Um, I also found that this lack of education is not only to our youth in the present, but stems all the way back to parents not even being taught about this major problem. So this is a generationally generational problem or issue. Um, Effects caused by stigmas, um, absence of communication, suicide and addiction, uh, family stressors. Um, an article by Ann Cook and a few others named "We Could End Up in a Lot of Trouble" discusses communications with in relationships with or among students and teachers. Um, they actually had semi-structured interviews and analyzed the data collected, and found that teachers were fairly they didn't feel right about these interviews. They felt uncomfortable. They were anxious. They were outside their realm. Quote, lacked necessary experience, end quote. Um, so they weren't even able to know how to deal with these kids and the issues that they were facing. Um, Again, the study found that the lack of communication between teacher and students um, was not only prevalent in the education system, but caused mental health problems and contributed to the stigma of the lack of knowledge concerning these major issues. Um, Effects caused by stigmas, or again, the lack of education. In another article, I was found that the sending and receiving of sexually suggestive photos and its link to mental health was tested using a survey among Pennsylvania ninth through 12th grade students. The survey included questions about consensual and non-consensual sexting, substance use, mental health, neighborhood safety, and demographic variables. The survey found that consensual sexting was significantly more likely in students who reported depressive symptoms and were more likely to use tobacco products and consume alcohol. So people suffering from mental health are more likely to interact in these negative outcomes and these so-called risk behaviors. And the study reported that sexting amongst men increased their participation in risk behaviors, um, which negatively affect their mental health and their life. So men were more likely to start chewing tobacco and drinking alcohol. And although this research further to needs further research to link sexting, cyberbullying, and even suicide amongst young adolescents, um, they were able to start it. Get something on the problem. Another issue, family stressors, such as moving. An NPR interview showed that an 18-year-old who moved across the country um, was once a honor student, never got anything below a B, and all of a sudden she changes schools, loses all her friends, and was unable to gain friends. And when arriving at the new school, not one teacher, administrator, or even a counselor asked if she was okay. And in doing so, she suffered mental health problems. And she was of the 20% of the students in the entire school who suffer these problems. Not a single counselor, teacher, administrator is asking these kids if they're okay. Family problems. Youth homelessness is actually really high, and data collected by the National Center for Homelessness and Education found that nearly 1.2 million children suffer from homelessness, and of that, a quarter of those kids were enrolled in public schools and experience in one way or another youth homelessness. Um, the study shows that youth experiencing homelessness had a disproportionately higher rate of mental health problems than their house counterparts, and goes further into detail showing how youth suffering from homelessness are 3 times more likely to consider suicide or use of drugs. So problems stressing in the family are important because if they're not talking about them at home, then we definitely know that they're not talking at schools. So who's talking to these kids about their problems? Um, Another article found that the effects of parents' mental health or life events. Okay, no, sorry. The effect of parents' mental health had greater effects than those of social or financial support. So adolescents were more affected by their parents' mental health than anything else. Um, this relates to my research of like lack of communication and the stemming of lack of education generationally. So the implications of my finding are serious, but if considered proactively, could potentially save the future generations If children are to succeed, it is highly necessary to create a comprehensive mental health education plan encompassing all parts of life, home, school, and life equally as important. Thank you. These are my references, my image references.